Hi, everybody. It's Dr. Patricia Coughlin here. I never think to ask anybody to subscribe or to like. I'm just not in that frame of mind, but it's been suggested to me because it really helps the channel and it helps get this information out to a wider audience. So if you are so inclined, I would really appreciate that. Recently I've been doing quite a bit of group training, teaching, supervision. And as I do, I start to see what the kind of common themes are, common misunderstandings, common difficulties in doing really tight and effective work, especially dynamically and in particular for those who are trying to really learn and master intensive short-term dynamic psychotherapy. And one of the things I really see is difficulty with phase 2 of the central dynamic sequence involving defense work. This is extremely crucial to successful psychotherapy. So I'm going to talk today about defense work, about restructuring defenses in such a way that the patient can turn on them, relinquish them in favor of facing their true thoughts and feelings. So often people are either doing almost too much restructuring in a very cognitive way, or they're skipping over it and pressing for feeling, or what Davenlo used to call fishing for feelings, when defense is still in operation. So again, if we think about and we understand the patient's symptoms and difficulties largely being an inevitable result of excessive reliance on defenses and avoidance strategies, then we can see how important that defense work is. So it's not enough for us to see that the patient is defending against his feelings in a way that's hurting him, right? That's creating and perpetuating his difficulties. He has to see that, right? So our job is to point out, right, how the avoidance strategies are actually creating the problem. So we have to identify those defenses, make sure we're looking at the function of those defenses, right, which is to avoid these very anxiety provoking and guilt laden feelings. So, on the one hand, it's understandable. I mean, who wants to be uncomfortable? And yet, we also have to look at the cost of that avoidance. So, even though there may be some very short term relief or gain in avoiding that whole mess, in the end, it's only perpetuating the misery. So, not enough for us to know it. You have to make sure that the patient gets that. And how do we know that they get it, right? And that they're not just going along with us or complying, right? Well, there are two cardinal signs that the patient is really getting and starting to turn on their defenses. One is that they'll say, oh gosh, I do that all the time. Here's an example. So they'll come up with a recent example of this. And I just saw this in a case that I was presenting where I was pointing out to this woman how she was creating emotional distance, keeping a distance from me. And she could see it. And then she said, I do this all the time. And even, if someone tries to give me a compliment, I'll brush it off and, run out of the room. So she's giving a fresh, new example, which is letting me know, oh, she really gets it. And the other cardinal sign is that the patient will begin to get really sad, right? So it's cognitive and emotional, really feeling the impact of how these defenses have hurt them, right, and deprived them. So the other really important thing I want to say about this defense work is you must do it with feeling. Okay, so what do I mean? We have to be somewhere very specific on the triangle of person. So we're going to be looking at symptom generating situations. The person got depressed, right, after this interaction with their spouse. Okay, so we're going to ask them, wow, so that's what happened specifically. What happened, who, when, where, what? And then we're going to start asking about the feelings toward the person involved. Okay, so number one, be somewhere specific on the triangle of person, typically in the current life where symptoms are showing up, or in the transference if something is happening there. Okay, and then the first step in restructuring is to ask the person, what is your feeling toward your husband? So too often people are doing restructuring in a cognitive way and too general. So when you get angry, you tend to collapse. Or they'll jump on, oh, do you see how you're attacking yourself? But there's no context. When, where, in what situation are they? If they're attacking themselves, right, and we're seeing that as defense, a defense against what? It's defenses against feelings toward this other person. So rather than facing the anger and the impulse to attack them, they attack themselves. So just saying, oh, you attack yourself in general and isn't that terrible, isn't going to be very therapeutic. So make sure you're in a very specific example on the triangle of person, and then ask about the feelings, right? So what's your feeling toward him? And they'll say, well, it's not really his fault. It's me. I'm such a pain in the ass, right? So that's where you can begin to say, let's notice here, right? You're not actually answering the question. So rather than face your feelings toward your husband, do you see that you're blaming and attacking yourself? Do you see that? Number one. Yes. Okay. And what's the consequence of that? I mean, that sounds like a prescription for depression, isn't it? Right? So they're going to start to see, right, the cause and how their defenses against their true feelings are causing and perpetuating the problem. So the real point I'm making here is that you have to be specific and you have to do restructuring of defenses with feeling, in feeling generating context, not just cognitively. So I hope you're getting those 2 points, right? Be specific on the trigger, the triangle, be somewhere on the triangle of person, and press for feeling, right, while monitoring anxiety and then pointing out the defense so the person can see it, see the consequences of it, and then turn on it. Okay? So I hope that's clear and I hope that's helpful. So give me feedback and we'll continue our conversation. Bye-bye.